heart attack, or stroke. Whichever one of these life-threatening emergencies, there is one drug that aids in their treatment and prevention. Clopidogrel can help. Clopidogrel, also known as Plavix, is an antiplatelet agent. This drug inhibits platelet aggregation by irreversibly inhibiting the binding of ATP to platelet receptors. In other words, it stops platelets from sticking together and prevents the formation of blood clots. Clopidogrel is especially used for the prevention of thromboembolic events such as stroke or myocardial infarction, also known as heart attack. Indications for its use are acute coronary syndrome, which can include a STEMI or NSTEMI, both just different presentations of a heart attack, one seen on the electrocardiogram or EKG, and the other primarily found through blood work and elevated cardiac markers, and stable angina as another indication. It can also be used in patients with peripheral artery disease or in those who have suffered from a recent heart attack or recent stroke. Clopidogrel is a pill taken by mouth and is well absorbed following oral administration. Distribution mechanism is unknown, however the onset of its effects on platelet function are within just 24 hours. It has rapid conversion to its active metabolite in just 30 minutes and has a half-life of 6 hours, reaches its peak effect after 3 to 7 days of administration, and its effects on platelet function continues for up to 5 days following the discontinuation of its use. Before getting started, talk with your provider and have them perform a thorough assessment, history collection, and lab work such as CBC differential and platelet count. Use of clopidogrel is contraindicated in patients with internal bleeding, intracranial hemorrhage, history of peptic ulcer disease, or if there's use of omeprazole. Once medication has been started on bleeding time during therapy should be monitored with prolonged bleeding time to be expected. Assessment includes checking for any changes in neurologic function, including signs or symptoms of stroke, such as slurred speech or sudden weakness to one side of the body, and signs and symptoms of a heart attack, such as crushing chest pain, the radius to jaw and arm with nausea vomiting. Opioid use can decrease absorption of the drug, and there can also be an increase in bleeding time when using chamomile tea, garlic, or ginger supplements. Side effects of clopidogrel include nosebleeds, chest pain, hypertension, GI bleeds, neutropenia, thrombocytopenia, dizziness, fatigue, weakness, eosinophilic pneumonia, fever, anaphylaxis, or any other internal bleeding, especially accelerated due to trauma. With so many different antiplatelet medications out in the market, and to increase your best chance of survival, ask your provider about clopidogrel today.